Are you tired of loose, sagging skin but not ready to go under the knife? Non-surgical skin tightening could be your answer. From radio frequency to innovative wands that tighten from within, we're diving into the latest options to firm up your skin without the scalpel. Curious if these treatments are right for you? Stay tuned to find out.
Welcome to the Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Harper Cosmetic Surgery in Charlotte, North Carolina, the Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper and Dr. Evan Zoog, also known as the Doc Dudes.
Welcome to the Doc Dudes. I am Dr. Garrett Harper, joined by
Dr. Evan Zoog.
And we are both board-certified plastic surgeons in Charlotte, North Carolina. Today we're exploring the world of skin tightening, why it happens, what you can do about it without surgery, how to decide what's best for you. There's so many options. There's so many companies that are making devices and telling you mine's the best and here's why and all that kind of stuff. But take it from a couple of doctors who've done all the research and have several of these devices, but we've got the ones that we think really work and have the science behind it. So let's get talking about it. All right, so what causes, this may sound stupid, what causes skin laxity? And we all know age, right? But what are some things that people do that makes their skin laxity worse as they age?
Not good skincare, sun damage, major changes in weight fluctuations, smoking.
Yep. Smoking's everything, right?
Those are the big ones.
Obviously pregnancy is going to affect people. Gravity, we're so thankful for it, but it also
genetics
can cause
too.
problems. Yeah, sure.
Some people just don't have as good skin.
I know. I feel like Dr. Graper used to show a picture when we used to do conferences here on site in person. He had a picture of Gwyneth Paltrow and her mom, and it was like, wow, that's pretty good genetics. Like that, passed down really nicely. They both still have chiseled jawlines, and one's 70 and one's 45 or something like that. So it's pretty phenomenal. Yeah. So, all the things that we think about, right? The tanning, all those things that we did in our youth that we know now aren't good, but we still let our children do it. All of those things. And the weight gain and weight loss are huge for that, right? Because a lot of times we stretch out our skin and we want it to rebound back, and it just doesn't. And so sometimes it's so bad that, somebody comes in and they say, I'm interested in this laser, or I'm interested in this procedure. What do you think? And you're like, oh man, that's not even an option for you.
Mm-hmm.
We got to cut out and remove skin. There's nothing strong enough, because the gold standard is going to be surgery, but sometimes people don't want surgery. Sometimes people are like, I can't take that much time off. I don't want the incision. Or sometimes people are just stubborn and refuse to kind of admit to themselves that that's what they need, and they don't want to hear that. And so you try to talk to them about it, and you try to let them know, it's a lot of times nothing that they did wrong, but that they'd be throwing good money at bad money if they went ahead and just started spending a lot of money on procedures. But every once in a while, and more now because we're seeing younger patients, right? Because younger patients' skin can typically rebound and respond to different therapies better than older skin,
Correct.
Right?
Yes.
Now, there are some 30-year-olds that have the skin of 70-year-olds and some 70-year-olds that have the skin of 30-year-olds. So good skincare, I've always said it. I hope people have listened. I hope people have paid attention in previous podcasts. I tell everybody, you want to stay away from the knife as long as you can, then you need to take care of your skin. And thankfully, we've got people here that can do that, right? So one of the benefits of going to a plastic surgeon's office and not just a med spa is that we can treat you with the therapy that you need, because we can offer all those therapies. When you go to a med spa and they have lasers or they have estheticians and they don't have a surgeon, right? When you're a hammer, everything's a nail. And that's how they are. And so here we have all the different levels, right? We've got estheticians that can take care of your skin with medical grade skincare. You can do peels. You can do regular microneedling. You can do radiofrequency microneedling, which we'll talk about in a second. You can do laser treatments. And we've got all of those things. You and I will talk about Renuvion here in a second when we talk about kind of minimally invasive stuff. It's not non-invasive, but minimally invasive. But that's what's great about going to a plastic surgeon's office, is that we can treat every single person that walks through the door. And
if our nurses or estheticians, other providers need an opinion, we're right here.
Right. And if they think that they've got a patient that they're seeing where it is just not going to get them the best result that the patient can get, then they just bump it up the ladder.
Yeah.
Right. And that's why it's great to have kind of the office that we have, and everybody works together, and we want what's best for I know it sounds so cliche, but it's like we do. That's why we're successful, because we do what's right for the patient, and then they tell their friends because they're happy with their result. The worst is when you get somebody who has been somewhere and they've said, well, I've done RF microneedling to my neck 6 different times. I paid for the 3 and I was so angry because it didn't work. And they did the 4th, the 5th, and the 6th, and it just didn't work. And you're like, I never even would have offered it to you. Like, that's not what you need. You need a neck lift.
Yep.
You need a facelift. And so a distinct advantage of coming to an office like ours is that, without a doubt, right? All right, so skin laxity can be treated. And we know that skin laxity is a combination of 2 things. It's going to be quality and quantity. And I talk about that all the time to patients. So there are quantity is you and me, right? You got too much skin. It's stretched out too much. There's no way it's going to rebound back. We got to cut it off. That's the gold standard. Quality are our estheticians, and even to an extent us, right? When we start to try to improve, I guess one of the best ways to illustrate how quality can be improved, and not just healthier, hydrated skin, and you're supporting it with the nutrients that it needs to be able to make elastin and collagen and those things. That's medical grade skincare. And that's we've known for forever. And that's, keeping out of the sun and using sunscreen and doing all those things, moisturizing and making sure that your skin is healthy. Skin can be healthy as a byproduct of the healthiness of your gut as well. And we're starting to learn more and more about that, right? So we're starting to learn how what we eat, how we take care of ourselves, and the makeup of our gut, which is our largest immune system, can make more radiant and prettier skin. But let's talk about non-surgical versus minimally invasive versus surgical. So when somebody says, I want non-surgical skincare, or I want a non-surgical option, what is that in your mind?
Lasers, Botox, dermal fillers, peels. Typically, those results are not as dramatic as a surgical procedure.
Sure. Yeah.
And oftentimes, the results are more temporary. So you need to keep up with, if you're doing these things,
maintenance.
You need to maintain it.
Yeah, you got to maintain it. And even after you have surgery, I tell people you got to maintain this, right? Because you can start the clock back and you can age really quickly, or you can take care of your skin. And from where we've set the clock back, it's going to take a long time for you to get back to where you were. Hopefully never, right? But I mean, non-surgical is exactly what it sounds like. No surgery. You're not going to sleep for anything. There's no cuts. There's no nothing. So you're right. So the lasers that our estheticians do, and then Botox and fillers, and some of the fillers now can even improve your skincare by hydrating it, right? That's what Skin Beeve does. And so that's been around for a few months. I think we were the first office in Charlotte that
I did it a few months ago, and I loved it.
Yeah, exactly. So it's one of these things where it's literally it is a skin injection. It's not a underneath your skin subdermal injection like some of the fillers are. This actually goes directly in your skin and helps hydrate it, which is super, super neat. And then our nurses do chemical peels, right? Blue peels, all those different types of things that you can do when you're awake, right?
Right.
Otherwise, you do one of these croton oil peels that like Dr. Graper does, and somebody looks like they just melted their face off for a couple of weeks.
Yeah.
You're going to sleep for that.
Yeah,
because that is a controlled chemical peel, but it can get that top layer of skin and into the second layer of skin, right? The dermis, which is the meat and potatoes. That's the fantasy land of the skin, the dermis. That's where your elastin fibers and your collagen. That's what we have realized we really need to help. Right? Some of the surface stuff that we've got, you want to take some of the pigments out with lasers, you want to resurface some fine lines, all those things, great. But if you really want to get to the crux of the healthiness of your skin, it's down in that deeper layer, that dermis, right?
And that's what some of these minimally invasive options are targeting.
Absolutely. So you just brought it up, minimally invasive. So what's minimally invasive mean?
So that it can be several things. I mean, Morpheus microneedling is pretty quick recovery.
Yep.
You don't have to go to sleep for it, but if you're working on a large area, then you may want to.
Yep.
But Renuvion is, I think, one of the best technologies for skin laxity.
Sure.
And I think of that as an actual surgical procedure, even though there's small little incisions.
Right. So nobody's having a big, huge, removal of a swath of skin or anything like that. You're using small little nick incisions to be able to place a device that's going to help your skin retract, right? Or it's a series of just tons of punctures. So with RF microneedling used to kind of be for the face, right? For the face and neck. And so everybody's done microneedles. It's a little roller that you see on TV that you can buy on Amazon that people think they can do at home and get just as good results. That's hogwash, right? So microneedling, like the skin pen, creates little channels, little holes by sticking thousands of little needles into your skin. And those little channels open up and you can then place a skincare product, sometimes hyaluronic acid, sometimes things like that, to help fill those little channels. And help kind of hydrate, plump up your skin, and just make it meatier, make it just have more kind of turgor to it. You can also fill in those little channels with your own blood, right?
Yep.
PRP. So you can use that. You can use exosomal therapy, which is another thing that we use along with the microneedling. And radio frequency, the addition of radio frequency to the microneedling is super, super neat, right? Because these needles go into that second layer of skin, the deeper layer of skin, the dermis, and then it transmits energy, radio frequency energy, which heats it up and causes it to contract. So we get contraction of the dermis, and we get those microchannel holes that can either be filled with something that PRP, exosomes, hyaluronic acid, or your body's also going to make collagen, right? That's how it's going to heal those little micro injuries, is by forming collagen. And so an increase in collagen, tightness to the dermis, all of those things is going to improve your skin laxity, right? Longer results versus the kind of non-surgical approach might have a little bit more recovery. But how do you use Renuvion? And how do you conceptualize, how do you tell patients what Renuvion is or how Renuvion works? I kind of came up with my own little thing, but I want to know, what do you say to people?
If I'm talking to a patient about Renuvion, basically I think of it in a similar way to liposuction. A lot of times when we do Renuvion, you want to do some liposuction as well. But it's a device with a long cannula. At the tip of that cannula, there is a little light, and there's also it delivers radio frequency energy, and it heats up that underside of the skin, the dermis of the skin, to a really, really high temperature. That if that tissue is not cooled off very, very quickly, it can cause a burn, and that was a problem with a lot of these previous skin tightening devices. Right. Patients would have burns and scarring and asymmetry.
Right.
And
so this uses plasma to be able to cool it off.
It uses helium plasma to cool that tissue off in 0.04 seconds. So you're not seeing those problems. And we also know that you have to get that skin to a certain temperature for that collagen to remodel, for it to, shrink wrap.
Right.
And And this technology that there's not another technology out there that I think does it as well as Renuvion.
Right.
But the kicker with Renuvion or any skin laxity, skin tightening procedures is it takes time for that skin to remodel and to get to that final result. Right. So you really have to set patients' expectations that this is not like a tummy tuck where you're going to look great in 4 weeks.
Right.
Or 8 weeks. It's going to be 6 months.
Yeah. And they tell you that it takes time for it to remodel. Now that's hard to come to a plastic surgeon's office and like have this kind of delayed gratification. That's not why we became plastic surgeons, right?
Right.
I didn't want to like be a doctor and have a patient come in and me work on their, diabetes for, the next 10 years, slowly and incrementally change their medications. I wanted like a wow factor. That's why we became plastic surgeons. So there is an improvement on the table that I see with Renuvion. The way I kind of tell patients is like the skin laxity improvement is kind of a byproduct for the actual target tissue that Renuvion really targets, right? So we all have attachment bands from our skin that go from our skin perpendicular down to our muscle or bone or fascia or whatever's kind of underneath it, right? And that's because your skin needs to stay where it is. I mean, we're not that kind of Alien in Monsters, Inc. where you could just kind of roll your skin all the way over your kind of, shape that wouldn't. Right. And so those bands, when you fill up with fat and get thicker, stretch out. And then just like any tissue, we want it to rebound back. And it doesn't. Sometimes as you get older, if you stretch it out so much, it's not going to rebound.
Yeah.
So that's the target tissue for Renuvion are those bands. And you're right when you said it like shrink wraps it, because that's what I tell people. It's really like going to slurp it right up and shrink wrap it closer towards your torso, which gives it this kind of functional tightening of your skin. And so it's a super neat thing. You do it in conjunction with vasor liposuction because you need the vasor liposuction to create the channels that expose these bands, and then the Renuvion goes in afterwards. But super neat. We looked at all of them, and we just felt like Renuvion had the best track record, had the best science behind it, and the best results. And so I think the combination of using vasor liposuction, right, along with Renuvion is just a no-brainer, right?
Yeah, and patients, if you have an issue with skin laxity, then you need to go to someone who does this a lot, because a lot of these things, if you don't do the correct thing in the correct patient, then you're not going to get a result that they're happy with.
I mean, that's so critical to plastic surgery. It's critical to everything in life, but in plastic surgery, it's like the plan is crucially important to getting a good outcome, right? You can do the most perfect RF microneedling ever that was done, but if that patient needed a tummy tuck or they needed a facelift, they ain't going to be happy.
Nope.
And we like happy patients. Also realize that with some of these, with the RF microneedling, that ain't a one and done. That's a series of three different treatment plans that are separated by 4 to 6 weeks, right? And it is the kind of additive effect of having those different treatments that gets you that beautiful result in the end. So if you have one RF microneedling session and you come back and you see us at your appointment, post-op appointment, you're like, I don't want to do it anymore. I don't like it. You're like, come on. We talked about this. Like, this is a series of 3. You got to do all 3 of them. And you can do more than 3, but you got to at least do 3 to kind of see any result, which is
I don't know what you tell people, but I typically tell them, a yearly maintenance. This is a really good idea.
And everybody's different, right? Yeah. I mean, the maintenance for a 35, 40-year-old is going to be different than a 60, 65-year-old. But I tell patients that even after we do facelifts or neck lifts on them, I'm like, look, I want you to do Morpheus and some of these treatments moving forward annually or every 18 months or 24 months, because there's really very little recovery time to them. Now, we did note that because RF microneedling kind of started at the neck and face, which is thinner skin and kind of daintier skin, we realized, well, what about the other skin in the body? What about under somebody's arms or with their thighs or with their abdomen or with their butt? Other areas like that. And we were like, well, why can't we treat it and expect similar kind of results and improvements? And you can. And so the folks gave us a bigger handpiece that we're able to engage a larger surface area, because the tip that goes on the Morpheus for the neck, if you were doing a thigh with that or an abdomen would take you like days, right? So there's a bigger tip that goes on the Morpheus RF microneedling. And we also realize that this skin tends to be a little bit thicker. You don't have carotid arteries and things like that lying underneath there. So it can go a little deeper, go a little stronger, and you can turn it up a little bit. So you dial the machine up, which is going to deliver more energy, which can be more painful. So what we told patients is we can numb your skin through a series of little local injections, which can work. Or, you can just go back to the operating room and we can give you a little cocktail, just like if you were going to have a colonoscopy, and then we can knock this thing out and really do it right. So we offer that here. Oh, it's amazing. It's totally changed the whole process, because these patients are able to be comfortable and our providers are able to dial the machine up to like what it's supposed to be, and not worry that you're going to be uncomfortable, right?
And sometimes some areas are not as good for Renuvion. Some areas are better for Morpheus.
Absolutely. I think once you see stretch marks, you need to do Morpheus.
Yeah.
And I think if you've got areas that you're liposuctioning, the addition of Renuvion's almost a no-brainer. But I've seen people who've done really well with Morpheus alone by itself, right? But I mean, with Renuvion, you got to do at least the vasor component. If you don't have subcutaneous fat, if you're super thin and you don't need liposuctioning or you're going to risk having contour irregularities, well, then fine. You still need to do the vasoring portion of that surgery so that these channels are made. So you still got to kind of go through that whole process. But
and we get contacted by people
absolutely
weekly about different devices and things, and
I feel like daily. This just came from Korea.
Right.
This one just came from Israel. This one just came from Bangladesh. Yeah.
And I feel like we have the two best technologies here that work great, and patients are happy.
I agree.
Yeah.
So who is like a really good candidate, right, for these non-surgical tightening procedures? Like, who is just your stereotypical patient?
Well, from a patient perspective, you don't want to have so much skin where it's overhanging.
Right.
You're not a good candidate. It's almost like you have a little bit of extra skin that is only apparent when you're like leaning over.
Sure. So mild sagging. Nobody that's just like too far gone.
Right.
Right. Because then you're expecting a device to do something that only surgery can correct.
Yeah. And you want
so there's limits to the device.
Exactly.
Yeah.
Exactly. And I've seen it done on patients where it doesn't help. So you have to have the right patient for it. And you have to talk, you want to ask them about their sun exposure and tanning beds and, their largest weight and their lightest weight and all those types of things. And feeling the skin, does the skin snap back at all? Does it feel thin? Like all those types of things are going on in my head when I'm trying to decide if this is a better patient for a tummy tuck or, Renuvion.
Totally. All right. So the four kind of devices that we're going to mainly focus on, right? We've already been, talking for a little while on them, but I just want to do a short little, we took the time to write out a description of the device so that our patients can hear it kind of verbatim. So let's read these to the patient. So for Morpheus 8, right? RF microneedling, we use Morpheus 8. That's the one that we use. It's customizable fractional treatment that stimulates the underlining layers of the dermis, that second deeper layer of skin. Radiofrequency, or RF energy, is scientifically proven to stimulate collagen. It's minimally invasive because it has the little kind of, series of poke holes through the needles, using a matrix of micro pins to target deeper layers of the skin with minimal downtime. Can be used on all skin types. Doesn't matter if you're white as a piece of paper or if you are African American or darker skinned. It does not matter. You can use it on all skin types in combination with other treatments. It's effective for the abdomen, legs, knees, back, face, neck, and even eyes. The treatment's generally most effective after you've done 3 treatments. So don't stop after your first or second one. It's almost like fillers and things like that. When somebody comes in, says they want to get fillers, dermal fillers, and they say, it didn't do anything. Well, you just didn't do enough because we know it works. You just got to stick with the series and do it. All right. So how about Renuvion? What's the shtick on Renuvion for them?
Yeah, so Renuvion can be used with or without liposuction, but generally more effective with liposuction, like we talked about. It's the only device that's FDA cleared for use after liposuction and the only device FDA cleared for contracting subcutaneous soft tissue. It's minimally invasive, a single treatment where the wand is inserted under the skin and delivers a unique combination of radiofrequency energy and helium plasma to the collagen-rich tissue. And this energy contracts these collagen-rich fibers and pulls the skin down closer to the muscle for a more contoured appearance. And it can be used on the neck, the lower third of the face, abdomen, legs, buttocks, arms, hands.
Yeah, I mean, really powerful. Cool. All right, Thermiva. So this is something that one of our estheticians really tackles for us. So Thermiva, right? The VA stands for vagina, is a quick, non-invasive, non-ablative women's wellness treatment. That's a nice way of saying vagina. Women's wellness treatment that uses radio frequency energy, you're going to hear that a lot, to gently heat the tissue in smaller, secluded areas. The radio frequency energy naturally stimulates your body's own collagen without using surgery, anesthesia, or hormones. Each in-office treatment takes about 30 minutes. The treatment, again, is recommended as a series of 3, and there is no, I repeat, no downtime. So Thermiva is a treatment for women's wellness, the vagina. And it's, we've had a ton of patients that have really had great kind of results from this, right? And helps with like your kind of sexual health as well. So Melissa Myers is the one that takes care of that. So if you want to ask her about Thermiva treatments or look it up and then talk to her, she's amazing. She's been doing it for a long, long time and has helped a lot of women out. All right. How about Aveli?
So,
or Aveli. Sorry. I know you like to kind of give that French twang. The Georgia
that's
comes
how
out
I first
of me.
said,
Yeah.
That's how I used to say it too.
Yeah.
But it's a minimally invasive procedure to reduce the appearance of cellulite. This procedure is often performed in conjunction with other surgical and non-surgical skin tightening procedures, but can be performed alone.
But what about, so this is a minimally invasive. You're making a little nick incision, and you're actually cutting the bands that cause the cellulite.
Correct.
But why would I need to do that when they've got those lasers out there that do the and like rotate around you and get rid of your cellulite?
Yeah. That doesn't work.
That's why.
You have to divide the bands.
Yeah, that's why. Yeah.
And it's an excellent procedure for patients.
So you have kind of run this part of the practice, right? And I know you call them like booty makeovers or something like that. So how are you using a combination of fat grafting, Aveli, and RF microneedling Morpheus to kind of get the best results to rejuvenate backsides on people?
Yeah. So, the Miami big BBL, adding a bunch of volume to your buttock is not going to last long. It's a trend in plastic surgery.
Please say that's gone. And
I don't think that's very attractive to do that. I think having curves and an athletic look is what women, at least the women who come into our office, want.
Yeah.
And I've kind of...
They don't want a big butt mass made out of fat?
No, they want a lifted booty.
Shocking.
Yeah. An athletic booty. And then there are ways that we can do that. A lot of patients typically need, when we're talking about a lower body rejuvenation or booty makeover, and a patient anywhere from 30 to 50, you're likely going to need to do to treat the cellulite. You're likely going to have some skin laxity and some hip dips where your buttocks kind of has gotten a little bit flatter and descended over time.
Sure.
So you want to thoughtfully add fat in those hip dips.
Okay.
not too much. And
So
then
like almost analogous to the face, right?
Right.
We're treating the butt like the face,
Exactly.
right? We're filling up anything that's loose. We're treating it with like the microneedling to help with the quality of the skin. And your ovally is cutting these bands that are causing it to suck in and give the little dimplings that
and
people
a lot
hate
of patients
with the cellulite.
think they just have cellulite, but it's also a skin laxity, volume loss, and ptosis problem, just like the face.
100%.
So whenever I'm talking to patients about the lower body, I talk to them about treating the aesthetic subunits of the lower body, just like I do the thirds of the face.
Right. And I always tell people like it's almost analogous to a pillow, right? And you like you go on a vacation. I've started bringing my own pillow. That's how old I am. I like literally bought like a travel pillow because I just never like the pillows wherever I'm staying. It's just going to ruin my trip. So that's a little tidbit on me getting old. But yeah, it's like a pillow. If you've got a softer pillow than you want, you can either add more cotton or feathers or whatever you want to make it a little firmer, or you can reduce the fabric size of the pillow, right? That's when you like roll it up and do all that kind of stuff to get to that more dense, because more dense is always going to be more youthful. So that's where filling it up, like using fat or using dermal fillers in the face and even in the buttocks, if you're using things like Sculptra, you'd spend a lot of money if you were putting Juvederm in your rear end, but Sculptra is a different kind of animal. But if you're using that, awesome. That's going to fill up the pillowcase. But then you also want to treat the actual like pillowcase itself. And that's where you're tightening that pillowcase to get that density, which is what the RF microneedling does. And you're using the ovally to get those bands.
Correct. And all those cases are very, very individualized.
Yep.
It's not like a breast augmentation or a tummy tuck.
Yep.
You're every single one of those cases is different for me.
Yeah, which I think also tells you, because they're all so different, I think it also tells you that mixing some of these therapies is critical in getting the best result.
Oh, yeah.
So if we've got somebody who is, one of our estheticians and they want to do RF microneedling on you, but they also think that adding some volume with one of our nurse injectors, listen to them. They're doing that so that you can get the best result, because a lot of these therapies are synergistic with each other, right? Where like the sum is greater than the equal of its parts, or whatever that whole saying is, right? Like that's kind of how these therapies are, which is great. Yep. All right. And then when is surgery better? When you need us. I mean, when you've got excess skin that we really got to remove and we think you are going to just not be satisfied with non-surgical or minimally invasive approaches, believe us.
Yeah.
Because I mean, besides you and your spouse, besides you and your best friend, like we're like not so distant behind them of who wants them to be the happiest and look the best, right?
Right.
Like that's what our jobs are. That's what we've created our practice to do. It's where we have focused our careers on making people feel better about themselves. It's a blessing that we get to be a part of this with people, but it's also like, it's not entirely altruistic. Like I love it. Makes me feel good to help other people. So
yeah, and we want to be proud of what we do. And I'm not ever going to offer something for a patient that I know they're not going to be happy with. But I think
that's what's great about coming to a plastic surgeon's office, because we don't have to sell you whatever equipment we got. Otherwise, we don't get in it. We got to make money. I mean, no, you don't. Like, not if it's the wrong thing. You want to be able to offer patients everything, and we can at Graper Harper Cosmetic Surgery. If you've got questions or topics you want us to cover on the Doc Dudes, head to ghsurgery.com, click on the Doc Dudes from the homepage for a link to submit those questions. Subscribe so you never miss an episode. New episodes drop the last Tuesday of each month. You can find the Doc Dudes on Apple, Spotify, YouTube Music, and everywhere you listen to your favorite podcasts, as well as through our website. Don't forget to follow us on Instagram and Facebook for the latest on new episodes and our practice. This is Dr. Garrett Harper and
Dr. Evan Zoog.
We are signing out on another episode of Doc Dudes. Thank you very much.